When a person suffers from stroke, the person needs immediate treatment at the hospital. Should the recovery be complete, apparently complete, is there any other steps that the person can take to prevent from a recurrence or to minimize the possibility of a second stroke? Because there's a lot of studies to show that it is usually when people have complications from stroke, such as loss in mobility, being paralyzed, or pass away from stroke. It is usually not the first stroke, but it will be the second or the third stroke that becomes fatal. This is a case for my dad, because when my dad got stroke, the first time he recovered 100%, apparently 100%, and he walked out of the hospital completely fine. But a few years later, a second stroke came and he went into coma and subsequently passed away. That's why this subject is quite close to my heart. Not only my dad, my uncle, which is my dad's elder brother, also had stroke. He survived his stroke. It was not his first stroke. It was a second stroke that paralyzed him, whereby he had one side of his body being paralyzed. And he has remained like that for about 18 years before he subsequently passed away from complication due to organ failure. Because he was not very mobile, so he didn't move around a lot. Subsequently, of course, without much movement, the body degenerates. His wife took excellent care of him. My auntie took excellent care of him for 18 years. I have a neighbor that she's very wise. She's the one that advised me, that told me, as I go into healing and I learn about healing and I start talking to her, she told me that many years ago her daughter has had stroke in her late 30s. When her daughter was in her late 30s, she had a stroke attack. So after being discharged from the hospital, this lady was very smart. She got her daughter to go straight for acupuncture treatments. Even though apparently she has done a full recovery, because she told me that after the stroke, it's never fully recovered, even though it appears so that the person has recovered 100%. But if the person do not do anything, no subsequent follow-up treatment, there will be a high possibility of a second stroke reoccurring, and the second stroke will cause paralysis or death. So it's better to be safe than sorry. Seriously. Yes, we now about 20 over years. I could see that her daughter is healthy. She is relatively sedentary. She doesn't like to move around a lot, but she's relatively free from any of the complications of the stroke, because she did a very thorough follow-up for acupuncture treatments. Now, I would like to go over the kind of treatments that you can consider after being discharged from the hospital, or if you or your loved ones have the stroke, and then after that you find that you have after the stroke you find that certain part of your body is weaker, or that there is a kind of like a twitch in your face, that is, your facial features are no longer balanced. Please seek out, continue to take whatever medication and whatever treatments that's prescribed by the doctor, but please consider seeking out alternative treatment as well, to complement and to ensure that the healing of your body is complete. There are some, I will actually relate to you my experience in observing those who the after stroke treatment for patients that I've seen around me. Because in Southeast Asia, we are relatively resourceful in this aspect. Most of the elders, once they are being discharged, they always will follow up with alternative treatments to prevent a reoccurrence. Or even though if the stroke were to reoccur, it will not be fatal or cause paralysis. The first form of treatment I've seen is Thai healing massage. Now, there's a lot of massage parlors in Thailand that they are not really going into healing, especially those which you see in many like red light district areas. All this, they do not know that the art of massage specifically for healing. Probably they do not do that. They just massage to maybe relieve stiff muscles and so on. But there are people, there are healers in Thailand that actually specifically use massage, whereby it's very painful. You go for these sessions, it's very painful because the more blockages you have, the more painful it gets. They use their finger and then they will push, a bit like tuina. They push and clear the blockages in your circulation. After that, you will feel much more relief. If you have pain or stiffness, you feel much more relief. I know of a healer in northern Thailand. I've seen him done it, and I have actually gone for treatment from him for my knee pain and all this. It's very painful. And I used to see stroke patients going to his place to be massaged. It's not a one-time thing. All this alternative treatment is not one time. You have to do it consistently until you regain the mobility. And then what they'll do is once they are okay, they will do kind of a maintenance kind of treatment whereby they probably go in like once a month or once every few months to make sure that everything is all right. The second form is chiropractic treatment. Chiropractic treatment can help to align the structure of the body and enable the flow of fluids from the body to avoid energy blockages. I have actually went for chiropractic treatments because I used to have lower back pain and shoulder pain when I was working. So I have gone for the treatments. And while waiting at the chiropractic clinic, I used to see stroke patients because they're very, you can see that they had stroke because part of their body is, one side is stiff or the facial features is affected. So I used to see them waiting in the office to undergo treatment for chiropractic. And my chiropractor has told me the benefit of the treatments. The earlier you go in, the better. For all these treatments, the earlier the better. Don't wait until the condition sets in permanently. The earlier you go in, means after being discharged, you go by the hospital, you go into the treatment to align, then the better chance you have for full recovery. Of course, you must be very determined and to heal yourself. Inside, you have to be very determined and you have to be consistent. It's not one time, two time. Sometimes it takes a few months for you to be able to see results. But then think about it. If we were to do the treatment and you are able to see the results after a few months, then you will be able to regain full mobility or a lot of mobility, which will enable you to go out and earn a living and not be dependent on others. So in the long term, there's a saving there. So here, this is what I would wish to discuss about the possible treatments. There's also another treatment that I recommend, which is called hijama or bekam. This treatment is done by traditional, is found in, it's a traditional Malay treatment, is also known as wet acucupping. So it helps to suck out it basically is like acucupping, but they will do incisions in the flesh, and then they will suck out the sort of like clotted or toxin or blood or from your body. I find this treatment to be very effective as well, but it may not be for everybody, especially people with low blood or people who are afraid of needles, so it may not work. But it's still a very effective treatment, if you ask me, even for general pain relief. So there you have it. These are the few methods: acupuncture, Thai massage, the proper massage, not just the normal. This is Thai healing massage, chiropractor, and wet acucupping or bekam or hijama. For more information, I will link to my blog post below that refers to this video, and please subscribe to my channel for future updates. If you would like to see any other further videos related to this topic, please leave a comment below, and I will try to do more videos related to this. Thank you.